what can I do in terms of prevention? I don't want to get sick in the first place. I don't want to get a virus. What can I do to boost my immune system? What can I do to help my family boost their immune system?
Yeah. I mean, this obviously could go also in 100 directions as well. I think if you look at the overarching antimicrobial stewardship recommendations, at hospitals or in retail, or even just kind of how, all of the different fields are blended and what they're suggesting, immunizations are big. So we've talked about that on prior episodes. Flu shots, COVID shots, politics aside, all of those sorts of things will hopefully reduce sort of the burden on different healthcare systems. So the less people that end up in the hospital, the less invasive treatments that are needed for those sick patients who often may have prevented with something non-bacterial, but once they're in there, they're on a ventilator, they're on ECMO, and they're on antibiotics, so that's the point. You want to keep people out of the hospital. Prevention in that respect is where obviously immunizations come in. If you're looking also at hospitals and even schools and in places of work, hand hygiene is huge. Make sure that obviously you're washing your hands, your kids are washing their hands.
Right.
Very basic. And then there are some other specific antibiotic issues and sicknesses that can arise from being on antibiotics that for too long. For example, C. diff. And so they'll often recommend isolation precautions and such for those situations. So immunization, hand hygiene, isolation precaution, sleep. This could be spun again back to various lifestyle things, but specifically looking at the stewardship part of it.
So it seems like there's a reason that certain people just don't get sick very often, and it's because they're doing some of these fundamentals, these basics. Obviously, nobody can prevent all viruses or bacterial infection. Sometimes you just get sick, but if you're doing the basics, if you're eating clean, if you're getting your vitamins and minerals, if you are sleeping properly.
And if we encourage at the pharmacy level, if we encourage people to manage their symptoms, that might prevent them from saying, "Hey, I need this antibiotic.
Right.
I need an answer now."
Exactly.
So that's
Very
why
well said.
that's why it's so important. We're emphasizing symptom relief for a reason.
Yes.
So they don't end up taking maybe the extra step that they don't need. And obviously when you're managing symptoms, you're not really promoting any healing either. It's just to kind of let the thing self-limit. And that's often what happens. Not every time. Somebody might have chronic issues, chronic lung issues, bronchitis, whatever. The point is just to hopefully let these things self-limit over time.
Yes. If it's not going to end up needing an antibiotic, let's do what we can to make sure that however you want to frame it, that you're not pushing your doctor into it or whatever the case may be, and still improving quality of life. So I think Dante said that perfectly. That's why, I know we obviously talk about a lot of natural health on this show, and it's like you guys just spent 10 minutes talking about these medications, but that's why. Because again, we are speaking to a direct question that's about antibiotic use, so that's part of it. But on the other hand, the drugs I'm mentioning here are pretty mild in small uses. I mean, Tylenol and ibuprofen, or acetaminophen and ibuprofen, you take those long term, those are a problem. Liver for Tylenol to keep it short, and for ibuprofen, kidneys, and cardiovascular. So not saying these things are just that they're candy, but when used properly, when used acutely, when you've got something going on, they in my opinion, they are okay. There are certainly some supplements you can do. In the winter, it's not a bad idea to at least get on a basic regimen if you're not on one all year. Vitamin C, D, probiotics, those are the basics. You can increase those whenever you do get sick. You can add in things like vitamin A and zinc. Also, when you do get sick, herb-wise, we still kind of mainly stick to the basics, but there are a few good herbs that we know of. We've got one kind of combined, we call it Virostat, elderberry, andrographis, astragalus, echinacea, all in one. That's one you kind of hit whenever you get sick. You kind of leave it in the medicine cabinet all year. Hopefully you don't need it. Hopefully it expires. But if you need it, you take two every couple hours for a day or two. Then you can back down to like one or two a day. If you really want to stay in the, in the more herbal realm, beta-glucan has been shown to increase neutrophil activity. That's one that's more on the maintenance side. You could take one of those a day, maybe throughout the winter, or if you've got some other issues going on, maybe immunocompromised, et cetera. So there are some other things you can do. Besides the basics, besides symptom management, if you do get sick, to maybe, keep it from a natural standpoint, to give you some relief or maybe keep some things at bay.
And supplement wise, those are primarily just designed to give your body what it needs to fight off whatever that issue is. That's not taking care of symptoms. That's where you need over-the-counter medications like ibuprofen and all the others that you mentioned.
And that's where, if you're really sick, where we like both.
Yeah.
You know what I mean? There's nothing wrong with a blending of these two worlds, so to say.
Cool.
And if you're not all that sick, then you just hit the supplements or whatever you want to do.
Yeah.
You know what I mean? If it's just, boy, I just can't stand at night that my nose is stuffed up, well, you know what I mean? You can do a little Sudafed if it doesn't keep you up, or you can do a little Benadryl just to try to clear you up a little bit. Those are things that, you can blend without feeling like you've got to live in
one world or the other.
Exactly.
Makes sense. Well, if anybody needs any of those supplements, we do have them available at our website, www.askjoedimatteo.com. They are all available there.